Menopausal changes to the vaginal tissue can make it tear and become more fragile. It can shrink the opening to the vagina and cause other challenging changes. But let's talk about how vaginal estrogen can change that. I'm Dr. Kent DeLay, a board certified urologist practicing in Lancaster and Indian Land, South Carolina. So, oral estrogens can do a lot for energy, can change bone health, but they aren't really enough to change the vaginal tissues. So local estrogen for genitourinary syndrome of menopause comes in three forms: creams, inserts, and tablets, and rings. Which one makes the most sense depends on your preferences. So let's start with the changes to the vaginal lining. Once again, we talked about it loses those rugae or folds, becomes more brittle because of loss of blood flow, and becomes drier. Vaginal estrogen restores those folds, makes it more elastic, and makes it lubricate better, which is better for sexual comfort. And finally, the C word, which TikTok hates, or the bean, and that little lip of tissue above it called the hood, once again becomes fuller, is less likely to stick together, and it becomes more amenable to comfortable sexual stimulation. If you have genitourinary syndrome of menopause or the old atrophic vaginitis, you don't need oral tablets of estrogen. You need estrogen applied to the area, and the changes can be huge. And we'll talk about some of the functional differences in the next video.